Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana. Now, you've seen me do these updates now for the past 6 weeks in conjunction with the leadership of the ACOI. And I hope these messages are helping you to keep up with the latest information on COVID-19. I know many of you are in the thick of the fight, and I'd like to thank you on behalf of all of us who focus on infectious diseases for a living, and certainly on behalf of the ACOI and the leadership of the ACOI. Now, I live in New Orleans, Louisiana, and I serve as co-chair for the ACOI Infectious Diseases Subspecialty Section. As we are facing this once-in-a-lifetime global battle, I want to hear from my colleagues who are experiencing the fight from their locations, no matter where you are in the country. I provide my contact information at the end of each update, so listen for that. And I hope you take me up on this invitation to reach out. Moving forward, together with the ACOI, we will continue to share information as it becomes available, as well as some hopeful progress that we are seeing along the way. Also, for more information on the ACOI's new peer-to-peer well-being check-in sessions that are available free of charge to ACOI members, please go to acoi.org/COVID-19 and click on the box so you can find out how you can join in. These Zoom sessions are an awesome way to feel connected and support during this very challenging time. So let's talk about masks, let's talk about speech particles, let's talk about how speech can spread virus particles, let's talk about transmission. This is really, really cool stuff. All right, COVID-19 transmission. This week I was super glad to see a study that was released from the Proceedings of the National Academy of Sciences of the U.S., also known as PNAS, or the Proceedings, on how the SARS-CoV-2 virus particles live in the air after an infected individual with the virus speaks. So, no pun intended, this is actually worth speaking about. Of course, we all know that respiratory viruses can be transmitted by droplets that are generated by coughing or sneezing. And the question that has been asked repeatedly is whether non-coughing, non-sneezing people can project the SARS-CoV-2 virus. Now, this new study presents us with strong evidence that by simply through talking, particles can be projected. No coughing or sneezing necessary. Now, the researchers from the Proceedings found that normal human speech emits droplets capable of carrying the SARS-CoV-2 virus, and that the droplets actually linger in the air for up to 14 minutes. This provides explanation as to why the disease has spread so rapidly. Now, what is less widely known is that normal speaking also produces thousands of oral fluid droplets with a broad size distribution that are causing airborne virus transmission of the SARS-CoV-2 virus. That's what the preceding researchers have observed, and they found that this is especially true in confined environments. That means that just being within close proximity of someone who is speaking and not wearing a mask is risky. So everybody needs to wear masks. Through normal conversation, speech droplets can possibly reach you, posing a real risk of disease transmission. Even more so, beware of loud talkers. In the study, a highly sensitive laser light revealed that loud speech can emit thousands of oral fluid droplets per second, increasing the transmission risk that much more. There's more detail about this about the study in the PANS, or in the Proceedings, including graphs on the light scattering observations in the link provided. Now, in addition to this, a study about the effectiveness of masks was also recently released by the Department of Microbiology at the University of Hong Kong. Now, also let me be very clear that this has yet been peer-reviewed. An experiment by a team in Hong Kong found that the coronavirus transmission rate via respiratory droplets or airborne particles dropped by as much as 75% when surgical masks were used. Now, here's how this study went. There was essentially a group of 3 groups of hamsters, and in each group they had hamsters with COVID-19 in one cage, and then they had healthy hamsters in another cage, and they were adjacent to the sick hamsters. Now, in the first group, there was no barrier between the two cages, and so 75% of the healthy hamsters got sick with COVID-19. In the second group, now if you're hoping that the hamsters wore little tiny masks, they didn't. Okay, so in the second group, they put surgical mask material around the cage, not on the hamsters, but around the cage of the healthy group, and 33% of the healthy hamsters got sick with COVID-19. So when they put the surgical mask around the sick hamster cage, only 15% of the healthy hamsters got sick. Now, there's also one more really cool finding to the study, and that is that the two groups of hamsters that had the mask around their cages, there was less virus found in their bodies than those that didn't have the mask at all. So for now, these studies are validating that wearing masks is sound advice. Also, check out the 3D simulation that the New York Times is making available online to demonstrate how keeping at least 6 feet away from others can help you avoid contact with these respiratory droplets and lower the risk of infection. And the link is noted in the references section of this page. One last thing, there's no question in my mind, especially today as the CDC just reported that touch of objects, right? The objects don't transmit virus as much, I think, as originally thought, that this is overwhelmingly a respiratory virus. This is the virus is transmitted overwhelmingly via the respiratory route, and masks are the most important thing that we could do to control the source of this virus at the exit of our mouth. So this acts as source control, and if everybody wore masks, we would decrease the rates of viral transmission significantly. So let's segue into the CDC and how they finally released their 60-page guidance on how to safely reopen. Now, last weekend, the CDC laid out their roadmap to help the country understand how to reopen with their main objectives to control the pandemic. The CDC has also provided state, tribal, local, and territorial health departments with extensive detailed guidance on contact tracing, infection control, and a wide range of other prevention and control topics. Now, they recognize that at the community level, recent events have shown the devastating effects that outbreaks can have among vulnerable populations, especially those in congregate settings such as nursing homes, prisons, and homeless shelters. And we all know that there have been similar outbreaks in food production plants and other critical industries which are crippling communities, both financially and creating concerns about the national food security. The CDC has made rapid identification and response to these events a priority to help mitigate the immediate impact and provide critical insights needed to prevent future outbreaks in similar settings. Consequently, the CDC has developed extensive tools to assist states, counties, facilities, and industries in responding to and preventing future outbreaks. Now, the CDC document also lists gating criteria and phase-specific thresholds in determining actions as each threshold is met. The CDC is also explaining in the document how they are ramping up efforts to perform contact tracing. Various steps for opening are covered. There's a specific guidance for schools, day camps, for kids as summers approach, for employer with workers at high risk, and for bars and restaurants. It also goes into detail for mass transit administrators on how to maintain healthy business operations and a safe and healthy work environment for employees while reducing the risk of COVID-19 spread for both employees and passengers. As we all know, some states have been open for weeks, and while some are saying that these guidelines are late, I have full confidence in the CDC and that they are acting as fast as they can given the difficult circumstances. So if you get a chance, please check out this amazing 60-page document. So please stay on the lookout for our regular updates, and to read more from the sources used in this report, you can go to acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and stay on top of this crisis. And please feel free to reach out to me at madery@mac.com. Please stay safe. We can do this together.